Yeah. Hopefully my computer crashed, so I have to log in and do the whole thing again. Sorry.
Yeah.
Was Jimmy able to get on?
They said they sent it to him. I just tried to call him, but he didn't pick up.
All right, so I just re-forwarded mine. So we'll probably get a bunch of people with my name log in real quick, and then I'll just rename them.
So you want to start?
Yes, go ahead.
Okay. Good afternoon, everybody. I'd like to call this meeting to order. This is the October 21st, Thursday, 4 p.m. Board of Health meeting. And I'd like to remind everybody that this meeting is being recorded by video and audio. And pursuant to the Governor's March 12, 2020 order suspending certain provisions of the open meeting law, any Nantucket public body that holds a meeting can do so via Zoom video conferencing. The video conference will be shown at Nantucket's Government TV YouTube page, which allows for the public to participate in the meeting as an attendee. Attendees must register to participate. The registration link is unique to the meeting. The registration link can be found in the description of the Nantucket Government TV YouTube live feed for the meeting. People registering to be an attendee must use their names, otherwise they will not be allowed to participate in the discussion. Attendees will join in listening mode. They can click the raise hand button if they wish to speak. The chair will call on those who have raised their hands in order they were raised. If you don't have any audio capable device, the Q&A button can be used to type a question. The YouTube chat will no longer be enabled. Any questions in there that cannot be verbally asked must use the Q&A function. Questions should be directed through the chair. And I do know that Malcolm's not going to be here. He's got a doctor's appointment, but I believe he's doing fine. We texted him yesterday. And Jimmy will probably be in pretty soon. And for attendance purposes, as I see you, could you please acknowledge that you are here? Starting with board members, Meredith Lepre.
Here.
Melissa Murphy.
Here.
Roberto Santamaria, director.
Here, and NCTV, can you set me up as a host? Thank you.
Kathy Flynn, inspector.
Sorry.
Jericho Mealy.
In attendance.
And we also have here, I see Arthur Gasparo down below. He'll be attending for one of the variances that he's seeking.
Here.
So, is there anything that's not on the agenda that the public would like to comment on? I don't think I see any hands. Do you?
Steve, it's Melissa. I don't want to interrupt public comment, but I wasn't sure when it was appropriate to mention this. I attended the Cannabis Advisory Committee meeting today, and we did not have a quorum, so we couldn't have a full meeting. But Chairman Rector said that I could not both represent the Select Board and the Board of Health on the advisory committee. So I'm just reporting back that we need a new member from the Board of Health to serve on that committee.
So how soon do we, is that something we have to?
We have a few weeks. The next meeting is, I believe, November 18th. It's at 1 p.m. before our next Board of Health meeting. So not sure if anybody, wants to think about it and volunteer for it, but I can't wear both hats.
Any volunteers? Meredith, Jim?
I can do it.
Okay. Can you, Melissa, can you make sure that that's represented to,
I sure can. I will send an email and copy you on it, Mary, to Barry Rector.
Okay.
I don't know if we need to take a formal vote or not, but I don't know how these things work with the advisory committees. I'm on new territory, but thank you, Mary.
Roberto, is that something we have to vote on as a board or?
Yeah, we'll have to put this on as that next month's agenda just to make it a vote, because this is on public comment. It's not on the agenda, so we can't.
Yeah.
Great.
Okay.
Okay. Thank you.
Thank you.
Is there anything else on the public comment? I don't think there's. See,
There's one public comment right now.
okay.
Yep, Tom, you're live.
Yes, in regard to the agenda meeting, is the discussion of masks going to be at the end of this meeting under the COVID discussion as far as status of that mandate?
It's the only emergency order in place right now, so yes.
Thank you for the clarification. Appreciate it.
Okay, thanks, Tom. That it? Okay, so we'll move to review of the minutes for September 16th, 2021. Any revisions or corrections? Okay, get a motion to accept the minutes.
I'll make that motion, although I was not there.
Okay, second, you're muted, Jim.
Second,
Okay, all in favor by roll call vote, Melissa Murphy.
Aye.
did you call me?
Yeah,
Yes.
okay. And Jim Cooper. He gives a nod, although we can't hear him. And Steve Visco says aye. Minutes are accepted. Okay, fourth thing on the agenda, release of ACO for Fraker, 1 H Street. Nantucket Survey is working on the compliant plan.
Yes, so the plan is being worked on right now. Everything should be good to go. We need a vote of the board in order to release the ACO funding in order to bring it back to them.
Motion to approve?
Get a second?
Second.
All in favor by roll call vote, Melissa Murphy,
Aye.
Jim Cooper,
Aye.
Meredith Lepre,
Aye.
and Steve Visco says aye. Okay, next, loan request for Unruh, 14 Long Ponds, Nantucket Harbor watershed upgrade.
Yes, both loan requests are straightforward upgrades to IA. We have no objections.
Motion to approve?
Okay, a
Second.
Okay, all in favor, Melissa Murphy,
Aye.
Jim Cooper,
Aye.
Meredith Lepre,
Aye.
and Steve Visco says aye. So loan request for 20 Long Pond, Nantucket Harbor watershed, same deal.
Same deal.
I'll also make a motion to approve.
I'll second.
All in favor, Melissa Murphy,
Aye.
Jim Cooper,
Aye.
Meredith Lepre,
Aye.
Steve Visco says aye. Okay, variance request, regulation 49, tight tank, 4 Main Ave.
Yes, so this is an application for a traditional septic system with an IA component. I believe Art Gasparo is here for the client. Art, the floor is yours.
Thank you, Mr. Santa Maria, Mr. Chairman. I am representing this application along with Attorney Reed and Attorney Bailey, who are both in the attendees list. So I'm not sure if, there we go, I promote them along with Mr. Jack Vaccaro. So we were all like to address the board on this. And at this point, I would defer to Mr. Reed and then go after him, please.
Go ahead, Arthur, if you can hear me.
Okay. Thank you, Mr. Chairman. As stated, this is an application for a IA system in the Nantucket Harbor watershed, which is an upgrade being required at the present time for this property. And the suggestion has been made, the agenda calls it a variance request. This is not a variance request. We are applying for the system, as described, the IA system. The language about tight tanks, this being on the so-called Nantucket Tight Tank District on the other side of Millie's Bridge, specifically says that in that area, the Nantucket Board of Health has determined that the property owner may be required to utilize a tight tank in lieu of a conventional system and or IA system in order to reduce nutrient degradation, et cetera. The point is that this is not mandatory. It is discretionary with the board as to whether the tight tank would be required. And as with any discretionary action, it would be obviously necessary for the board to act reasonably in accordance with the facts that are presented in the case. And with that, I'll turn it back over to Art to describe what we're doing here.
Thank you. So through you, Mr. Chair, the plan that we've prepared and is in your packet is for the upgrade of an existing system that has failed due to inadequate separation to groundwater. It's a 3-bedroom system on a 16,000 square foot lot. And we have done the required soil testing and design and filed the application for an IA septic system, which replaces the existing system in its entirety, providing a new 2-compartment tank followed by Septitech M400D processor that then is pumped to a new leach bed for the soil absorption facility. That leach bed would be greater than 5 feet above estimated seasonal high groundwater as determined by soil testing that I did, which had been witnessed by Mr. Crowley. The system complies with all of the Title V regulations, and the only relief would be required is with respect to the Nantucket regulations as far as being less than 150 feet to a well, but we're greater than 100 feet from a well, and being less than 50 feet to a property line, but we are greater than 10 feet to the property line. The system, we believe, represents a significant upgrade compared to existing conditions, both through the increase in the separation distance to groundwater, along with the inclusion of nitrogen reducing technology. I would add that the size of this lot is larger than a lot of the other lots that are over the bridge. So we are able to, utilize an on-site system. My belief is that when the tight tank district was, approved, it was in such a way that it was helpful to a lot of these lots to be able to utilize a tight tank where you otherwise, under the current Title V regs, would have had to either go to a seasonal deed use restriction or, prove absolutely no other alternative. And then sometimes that might have meant that on-site systems would be required with additional reductions from the Title V requirements. I think that this lot is different because of the size of the lot and the way that the wells are configured, and we're able to comply with that. And as such, it seems that the most appropriate application here is to utilize an on-site system. And with that, I would turn it over to Mr. Bailey, who would also like to address the board.
Can you hear me? Yes.
Yes.
Okay, thank you. My name is Dan Bailey. I'm a land use lawyer at Pierce Atwood in Boston. Of course, something's going to interfere right away. Sorry about that. I've actually been working on land use matters with Arthur and Art for close to 25 years on Nantucket, but this is the first time that I've appeared before the Board of Health. You have a letter from me dated October 14th that explains why, from a legal perspective, you have authority to approve an IA system in the tight tank district. This is, plainly, it goes to the may as opposed to shall. And as Arthur mentioned, Regulation 49 says may, and may means may. It gives you the discretion you may require a tight tank, but you also may not. We are asking that you exercise your discretion to allow an IA system like you have in several other locations within the Nantucket watershed, albeit on the opposite side of the bridge. Our point, I think Art has already made it, but I'll repeat it. That is that the only difference here is that those IA systems were on the other side of the bridge. But from a technical perspective, this particular property is in at least a good, if not a better situation to have an IA system rather than a tight tank. I'll also remind you, this is something you know better than I do, that's for sure, that, tight tanks, both in your regs, in the purpose of your Regulation 49, as well as in Title 5, are really, they're to help the homeowners as a conditional last resort rather than not being able to use the property at all. Conventionally, IA or compliant systems are always preferable to tight tanks. And I'd also say that having an IA system is consistent with the studies, and I cited them in my letter. Jack has cited them in his materials, but they're consistent with the studies that evaluated total nitrogen reduction strategies in the Nantucket watershed. So with that, I will turn it over to Jack to speak to those technical issues just a little bit more, and I'm available for any questions. Thank you.
Go ahead, Jack.
Thank you, Dan. Can everyone hear me all right?
Yes.
Great. So I'll be very brief here, but I just wanted to emphasize the point that Dan brought up, that we did look very closely at the materials that were developed by the Massachusetts Estuaries Program for Nantucket Harbor and Hither Creek, and the recommended nitrogen loading values that were developed in 2010 and emphasized by a DEP study 5 years later in 2015. We also took a look at some of the recommendations that were developed by SMAS for the town of Nantucket to look into various strategies for nitrogen reduction, including the elimination of nitrogen entering the system from the town landfill, conversion of on-site sewage disposal systems to IA treatment technology, updating land use restrictions, enhanced aquaculture, and dredging of Hither Creek. These are all strategies that were thought to provide avenues for the further reduction of nitrogen in Nantucket Harbor, but more importantly, Hither Creek, which is an area of more serious concern with regards to nitrogen. We've looked at the design that Arthur has brought before you, that Art Gasparo has brought before you, and we've concluded that it would result in a significant reduction in the amount of nitrogen that's entering Hither Creek from this site, roughly a little bit better than half, a 50% reduction in the total amount of nitrogen from this system. It's a significant point, important to point out that we're talking about nitrogen content of approximately 0.0522 pounds per day of nitrogen, which amounts to about 10 to 5, a reduction from 10 teaspoons of nitrogen per day to 5 teaspoons of nitrogen per day, exiting the site through this system. So it's a significant reduction in the amount of nitrogen. We agree that the regulations do allow for the discretion of the Board of Health to allow for innovative alternative treatment at this location. And we just, we have submitted materials to the board through Dan Bailey's materials that are supporting the application and recommending that the Board of Health approve the septic system as designed.
Great. Does anybody have any questions for Jack, who was just speaking?
I'd like to talk to Roberto. Who made the decision? When did we make the decision, or who made the decision that everything over the bridge would use a tight tank?
I think that regulation was passed in 2015. It was right before I started.
17, I think.
Oh, so it was 17. I think in 17 is when we had to update it for something.
Yeah, we had a person on Ames Ave who had a permit that for an IA in 17, so we allowed him to, since the permit was issued, we allowed him to install it, and I believe that was the last one to be installed since 2017. Everybody else who had an IA over there previously had one in there. So since that one on Ames Ave, there hasn't been a IA system installed over there since then. And, I think we talked about this during that discussion. Was the point was we didn't want, in that small peninsula over there, we didn't want any nutrient loading entering into the groundwater table. So hence we decided to be a tank zone only.
So I'm looking at the reg, and the original approval was May 21st of 2015, and then at 2017 was the last time we looked at it.
My next question would be, Roberto, why do they want an IA system rather than a tight tank? With a tight tank, we have nothing going into the ground.
Correct, but that's not a question for me. For us, we would prefer the tight tank, but the applicant is requesting that it's not a tight tank.
All right, if they requested an IA tank, are they looking for extra bedrooms?
We cannot add extra bedrooms. I think they're limited to the amount of bedrooms they have because it's only a 16,000 square foot lot. So regardless of whether it's a tight tank or an IA system, they're still tied to 3 bedrooms. I think it's 3 bedrooms. Am I wrong? Okay. I don't want to speak out of turn. They're tied to 3 bedrooms regardless. The difference between an IA system that's in or whether it's a tight tank is you can't do new construction on a tight tank. You can't do any expansions. Tight tank is very restrictive.
Well, out there, you'd be restricted to what the original permit was for the size of the septic. So even with the tight tank, you're not limited to a seasonal use. If the people wanted to use it year round, they could use the house year round.
Correct.
That went away with when the state turned over the discretion to the local boards on tight tanks. But yes, there are some small lots over there, Jim, that are unbuildable.
Yeah.
You cannot use because it can't fit a septic, and you can't use a tight tank for new construction.
Right. Okay.
Yeah, the main reason we had originally moved it into a tight tank district, quote, tight tank district, was because it's a velocity zone. A significant portion of that whole area is a velocity zone, and another big portion of it is in the floodplain. So, and when I say the floodplain, it is in AE9, so at 9 feet of elevation, the floodplain that's there. So that was one of the primary factors as to why we made that whole area discretionary type tank district.
Melissa?
Thanks, Steve. I would love to hear the response to Jim's question, though, about why they would like the IA system as opposed to the tight tank.
I guess that's to me.
Yeah.
A couple of reasons. First, with a tight tank, you have to obviously truck and pay for disposal of every drop of water that you use and wastewater that you generate. So you have to be concerned with that tank becoming full. How often is it filled? So it's more of a ongoing maintenance and something that you have to keep up with, as well as to get, I believe the charge is somewhere, Mr. Visco probably know better than I, but I think it's between 8 and 12 cents a gallon. It's down to 3 on a tight tank. For every gallon, and then you have all of the hauling fees as well. It's not only economic. And then the other point of new construction, as Mr. Santa Maria referenced, it's not that if they wanted to do anything else on this particular property, then they without expanding the bedrooms. Again, we have a system that is permitted for 3 bedrooms. We're only asking for a system of the same amount. You would not be able to obtain a permit for any other. It's not just construction either, as it's being, the new construction definition is being interpreted as creation of any habitable space. So if you were finishing a basement or a small addition, anything, even if it doesn't increase bedrooms, then that's not allowed on the tight tank. So for all of those reasons, the on-site system is preferable to these owners, given that they can comply, and even further, where the regulation does read may and not shall. It doesn't say that you have to do this. And then this property isn't within the flood zone. Well, much of the point is this one isn't. I could clarify. It should say it's not within the 100-year floodplain. There's a small portion of the property where the septic system's not within, which is within the 500-year flood zone. But again, that's not one of your A zones. And I'd be happy I could share a screen or show you that if you wanted, but I just so that you know.
May I ask a follow-up, Steve?
Sure.
I'm going to steal Jim's question that he always asks, is what is staff's recommendation?
The staff will always recommend the tight tank in this area, which is actually why we're here.
All right.
Thank you, Mr. Chair. If I may, I think there may be a little bit of a disconnect. I just know that, and in the email that is in the packet that I included, whether it's a board directive or staff, I don't know. I'm not saying that would change Mr. Santa Maria's position, but it was told to me, we actually filed for this permit application and was told that that you need to take this to the to the board, because we believe that the board wants these to be tight tanks, and to seek that clarification, though we weren't able to find anywhere where that's codified or says that the board says this has to be a tight tank. And I would also note that Attorney Bailey also would like to address the board.
I may, Mr. Chair.
Go ahead, Dan.
Thank you. The sort of legal point that I want to make and draw out is, I don't want to say I understand anything, because this is the first time I've been before the Board of Health, and I've boned up on these issues, but I am certainly not an expert. But I understand why you would want the ability to do tight tanks in Nantucket, because a lot of the properties are very small, and there's really not much alternative. But the studies that you based your regulation 49 and your regulation 51 on, those studies were of the entire watershed. They weren't just for, on the west of Millie's Bridge. And those, I'd argue that as a legal matter, you have to treat all of the property owners that are the subject of those studies the same. And when you have a property owner like this one who can install a largely compliant IA system similar to systems that were installed on the other side of the bridge, that this is exactly the case where you should use your discretion to allow an IA system rather than a tight tank. Thank you.
Meredith?
So I just have a question about, so it's within 100 feet of a well, and is it supposed to be 150 feet? I'm just wanted to clarify that.
Through you, Mr. Chair.
Go ahead, Art.
The proposed system is greater than 100 feet from a well, but less than 150. Title V requires a minimum setback distance of 100 feet, though the Nantucket regulations require 150.
So it should be 150 feet away. Is that correct?
By the Nantucket regulations,
Okay.
but not by Title V.
Okay.
Anybody else?
Well, I just want to say one thing. If we're looking for the total benefit of one system against the other and what's going into the ground, you can't accept anything except the tight tank is the better of the two. With the tight tank, we have nothing going into the ground. With the IA system, we have stuff going into the ground. So if you're looking for the better of the two, you have to go with the tight tank. That's why the people over there have tight tanks. Thank you.
I'll take a minute to just clarify, if anybody's wondering about the costs of, and I do many tight tanks over there, and ours designed many of the ones that I take care of. And cost between installing that 3-bedroom IA and the tight tank is going to be a significant difference. Although there are some costs with the tight tank, it's actually part of the sewer system. So I do believe you pay the sewer privilege fee when the tight tank is installed. But at 3 cents a gallon, I'll just give an example. If he, had a 4,000 gallon tank and then the alarm goes off at 2/3 of volume, I go 3,000 gallons, 90 cents to dump it, and roughly $300 for me to pump out. And maybe on some of those houses, with those size tanks, some of them I haven't even been there 3 times in the season. So it all depends on use. Some of the people rent their houses. That tends to be a little more than when renters are there and they load the houses up. But I think the cost would, just to let anybody know, the cost with putting the IA in is, that's going to be between a $50,000 and $60,000 system. Tight tank, I have no idea. I'm not in that business of installing. I'm guessing it'd probably be half that. Does anybody else have any questions for? Hey, Arthur, go ahead. I see your hand.
Yeah, just to wrap up, I think a more rational basis for the regulation and for the interpretation of the regulation would be to apply it lot by lot, property by property. And what I mean by that is that obviously there are many lots on the far side of Millie's Bridge that should have tight tanks. And by the same token, there are many lots in Nantucket on the other side of the bridge that should have tight tanks. And it would seem to me that it would be more appropriate to apply the regulation across the board to all of Nantucket, but to apply it the way it's written as a may rather than as a shall, which is the way that you seem to be treating it, even though the language doesn't say that, and apply it across the board based upon the characteristics of the lot, rather than the accident of which side of the bridge it happens to be on. That's all. Thank you very much.
Yeah, go ahead. You just need to unmute your hands up.
Thank you. Sorry about that, Mr. Chairman. I just wanted to emphasize a point, and I apologize if I'm beating a dead horse here, but one thing I found very interesting in reviewing the reports that were developed under the Massachusetts Estuaries Program was that there was very clear that it was very clear that the quality, the water quality within Hither Creek was worse and worse the further upstream you went, right? And so it just does seem peculiar that this particular area of Nantucket, the far side of Millie's Creek, is being treated very differently from the other densely developed areas of Nantucket further up Millie's Creek, where further up Hither Creek, where IA treatment systems have been approved by this Board of Health. So I really think I agree with what I'm hearing from Arthur, that this is a policy that should be considered very carefully by the Board of Health, because those septic systems further upstream are having just as much, if not more, impact on the water quality within Hither Creek. Thank you.
Anybody else have any questions? Seeing none, so can I get a motion to approve or disapprove the variance from an IA to a tight tank?
I'll make a motion that we deny.
I'll second.
All in favor by roll call vote? Jim Cooper,
Yes.
Melissa Murphy,
Aye.
Meredith Leprey,
Aye.
and Steve Visco says aye.
Thank you for your time.
Thanks, Art. Thanks, Arthur.
Thank you.
Okay, next. Okay, PFAS contaminated well abandonment discussion.
Yes, so what we've been looking at right now is that over the course of these last few years, we've been paying attention more and more to emerging environmental contaminants. And as those contaminants and the information that provides, that they're providing for us, we're finding out that more and more it's becoming dangerous. And we've been finding, and PFAS is the next battle. PFAS stands for perfluoroalkyl substances. That's everything, things like Teflon, Gore-Tex, Next Gen, things that make it's like a liquid or a coating that will make other things non-stick. It used to line oil drums, it used to line drinking water tanks, whole 9 yards. And now we have found that PFAS in general, so far 6 regulated, but more information is coming out every day, how dangerous it actually is, and PFAS is causing cancer across the world. So as we've found is that the aqueous film forming fluid, forming foam, AFFF, that was being used in the airport, the firefighting academy on Cape Cod, most military bases, things like that. That sort of contamination has entered the groundwater. What we're also finding is other sources of PFAS not related to the airport in other areas around the island. We'll be having a discussion in depth about this, the UMass testing program at 5:30 today. So we recommend anyone watching to stay tuned for that. But what we're also seeing is there's no set recommendation or policy of what to do with those wells if they are found to be positive. The maximum contaminant level for PFAS in the state of Massachusetts is 20 parts per trillion. The maximum contaminant level for the EPA is 70 parts per trillion. So as it stands is, because the EPA standard is higher than the state standard, if we're between 20 and 70, the EPA won't step in. So we need to make our own recommendation. So what I recommend to the board now is I'm asking you to vote or ask for a consensus at least that if we have contamination in a drinking water well or an irrigation well above 20 parts per trillion, and they are able to access town water, I'm asking that you recommend to abandon the well in its entirety. That means either pulling up the casing and filling in the hole with bentonite or another type of source. So in order to solidify it and to prevent access ever again. What we've been seeing is that in some areas, because we don't really know a lot about the PFAS cycle, but we do know where it is here. If you turn it from a drinking water well to an irrigation well, you're just bringing the PFAS to the surface and recycling it into that same property. And it will still come right back into the same groundwater. By abandoning the well altogether and connecting to town water, that is your best bet at preventing PFAS contamination and any other emerging contaminant in the future. So, Meredith, of course.
So, but couldn't you put POET systems on these wells so that people could use them for irrigation?
You can.
Then you're not putting it in to the water or into the ground?
So correct. You can put a POET system in other types of filter systems like carbon systems. The issue is that you have to maintain those systems a lot, and we don't have, once those systems, the carbon that gets removed is contaminated with PFAS, they need to be handled as a hazardous waste, and that becomes very difficult. And as we've all seen, when you add that sort of a recommendation or a regulation out there, something like the ATSDR, the cradle to grave situation, it's really expensive to get rid of hazardous waste. So people are going to start just dumping the carbon filters, which is even more dangerous because we're now concentrating PFAS in a specific location.
Roberto, does it make any difference the depth of the well? Some wells are 30 feet, some wells are 100 feet.
It absolutely does. It absolutely does. The primary PFAS that we're looking at, the 6 main regulated ones in the state of Massachusetts, there are 24 PFAS of concern, but there are only 6 that are regulated here so far. Those tend to float. So they're found usually in the first layer of water, of groundwater. However, because it is such a slippery molecule, literally a slippery molecule, it goes in between the rocks, it goes in between the sand, and it can seep to lower levels. We're not finding it right now in Nantucket, knock on wood, in deeper wells, but it doesn't mean we will not in the future. But so far, we haven't. But yes, the well depth does definitely affect it, but so does proximity to the source of PFAS.
So what do people do? I live in Tom Neris. My chance to get in town water is right now it's nil.
Yes, that's where the requirement would be something like a POET system. You would want to do a POET system. Unfortunately, like we were saying, you have to handle this filter as a hazardous waste. I know it's not the answer people want to hear, but it's what we have so far.
May I ask a question? It's actually 2 questions. Thank you. One is, what is the availability for homeowners to get their wells tested? And I guess the second question would be, have we talked with the Public Works Department or Waste Options about, increasing availability for hazardous waste collection to supplement any kind of order or recommendation that we make like this.
So I'll answer the second question first, because honestly, I'm already forgetting the first question, so I'll need you to repeat it. The second question, as far as DPW and waste options and things like that, we were already in that conversation before Rob left. So they were going to look into it. We just need to bring that conversation back up. Right now, they're more shorthanded than we are, so I don't want to throw too much of a burden on them. But it's definitely a conversation that we're having. And
Right. I'm a big proponent that we have the systems in place to deal with the waste that we're recommending people collect if we're gonna recommend a POET system. But the first question was, what's the availability of testing for private homeowners for their wells? Because as I understand, it's very challenging right now to get that. And I would think that any policy we set or adopt would need to be concurrent with availability of both the testing and the waste removal.
Correct. So the issue with testing is that only specific laboratories have the equipment to test it and calibrate it to test for PFAS. So right now, the bottleneck is how many laboratories can do it. So as a result, it's expensive. The UMass DEP program that we were able to partner with, they were only able to test the 50 wells. I had originally said 40 the other day, but it was actually 50. So that's because that's all the funding they had. PFAS testing can be in the thousands of dollars, depending on how many of the PFAS you're looking to test for. So what we are doing is we are revamping the PFAS website right now. You may have seen that it was taken off the homepage for a little bit while it gets worked on. So once that PFAS button gets up and running, we'll have laboratories that are available, a list that are available so that people can use it and send their samples.
I guess just one more follow-up, if you don't mind, Steve. Can you remind me, Roberta, because I've already forgotten, what it is you're asking us to do today? Is it to recommend a policy? Is it to work with you on developing a policy? What direction are you looking for?
Yes, so what I'm asking is that when there is a PFAS contamination above the state's maximum contaminant level and access to town water is available, that the well be abandoned and that you connect to town water.
Yeah, and I would think that just makes sense. That's a no-brainer. So does anybody want to make a motion to accept that as a policy for?
I have to recuse myself from this. So
good point.
I can't vote, but I do think all of the people affected by the airport, it's asking a lot to go from having a well to now having to pay a water bill to then not even be able to use your well for anything. But I'm recusing myself from the vote.
Well,
I mean, the policy is like you said, it's if town water is available. I mean, they'd have to have the other option of putting that system on it to clean the PFAS. But if the town water is available, I just think that's, that just makes sense.
I also feel like it makes sense, Steve, but and I don't know if this is the practice of this board. I would love to see a draft policy and perhaps even the supplemental information that Meredith offered of parameters of when a POET system is appropriate, and a timeline that people have to do that. I mean, I think this is it's a great sentiment, but I think that it needs a little bit more vetting. And I think, it needs to be in writing so that the public has some notice to look at it and respond to it. So my recommendation would be that we get something in writing for us to vote on at the next meeting.
Okay, sounds good.
Sure.
Sounds good. So I can write up a proposal of what we recommend, and then I'll talk to our internal PFAS crew here, and then we'll go from there.
Thank you very much for bringing that up, Roberto.
Just a quick question on the PFAS. I mean, what, they call it's a forever molecule. It doesn't go away.
Yeah, the problem.
Break down. It's not a natural.
Yes, so that's the problem. PFAS is all PFAS. There have been something like 6,000 different types of PFAS that have been categorized already by the ATSDR, the Agency for Toxic Substances and Drug Registry or Disease Registry. So what we're looking at is fluorine, which is the fluoral, when they say perfluoroalkyl substances, is what's called the most electronegative element on the periodic table. What that means is that once it bonds, it has bonded, and it takes a lot of energy to break that bond. So when you've bonded it with a carbon, which is what a PFAS is, a chain of carbon, that is one of the most stable molecules ever created. So they're calling it a forever chemical because it doesn't just break down.
It's not.
So Roberto, how are we sure that there's no chance at all of the well water that the water company uses is free of this?
The water company is testing quarterly. They are testing their wells quarterly.
So is the difference that their wells are much deeper than the average person's well on the island, or is it just that they just test them quarterly?
They test them quarterly, but their wells are much deeper. They're in a completely different layer of the aquifer.
So basically, it's not the same water that we use for the wells.
Correct.
Okay.
Correct. Your typical irrigation or drinking water well serving a home, and like Tom Nevers, for example, or Nantucket, is that they're taken from a recharge area of water. So it's groundwater that is fed by ponds, rain, certain runoff, things like that. Whereas the wells that the town uses, the water company uses, is deeper in the second layer of the aquifer, and it doesn't recharge in the same way.
And I think we're just at the very beginning stages of private well owners being able to have access to testing.
So Mark will be at the 5:30 meeting.
Oh, great.
So that's actually a really good place to ask him these questions too. I'll also bring it up so that he can answer these questions.
Roberto, just one follow-up to that. I think whatever we do adopt, that we make sure it's easily accessible by, for homeowners to find on the website and in clear language. I just feel like there's going to be a lot of moving parts with PFAS. So whatever it is, that make sure we're cross-posting it both on our website, the PFAS website. It's just easy for people to find.
Sounds good.
Any other questions for Roberto? Okay,
No.
We'll move on to the internal decision policy.
Yes, so it's in your packet. What we're asking for is to be able to approve maximum feasible compliance in-house. What you see in that policy is that what usually happens is when somebody comes in and applies, they need something, there's a 3-bedroom septic system that's pre-existing and they just want to upgrade to an IA, but they need a setback variance. Usually we make them have to wait until the next Board of Health meeting. And then it's just like these loans where we get to the Board of Health meeting and then we say, we have no objections, this is maximum feasible compliance, and it goes through consensus. So what we're asking for is to get that off your plate so that you don't get frivolous variance requests.
That makes sense to me. It's going to save the board some time, plus the engineers and surveyors basically a month.
Yeah.
They had to wait. on something so simple.
I'd make a motion to approve the internal decision policy.
I'll second that.
Okay, all in favor by roll call vote, Jim Cooper,
Yes,
Meredith Lepre,
Yes.
Melissa Murphy,
Yes.
and Steve Lisco says yes. Okay, COVID emergency order discussion.
Okay, so as we move along and as we're moving into the next season, a lot of the big portions and the wheels that are turning in COVID, we have to start learning to live with it, is really where we are. If the small council of the FDA, or we call it the small council, but like the ACIP, already met today to discuss. The ACIP already discussed approving the vaccines for children ages 5 to 11. So once they've already recommended approval, so we should be able to start vaccinating. Or when I say we, I mean the hospital, because it has to be done in a clinical setting. The hospital will be able to start vaccinating children. With the new treatment from Merck, Molnupiravir, it takes me a while to remember, I have to visualize it. The Molnupiravir, that's been approved now by the FDA as well, and it does prevent severe sickness and hospitalization. The vaccines are out there, and I learned yesterday at at the MHOA conference, the Mass Health Officers Association, that in the state of Massachusetts, for all communities 10,000 people or over, Nantucket is #1 in the vaccination category. We have vaccinated more people than any other community in the state of Massachusetts. There's not much more to go from there. And then in the last month or two, we have had 2 new inspectors start. We had Artel retire, and then we've been running the clinics over and over again. So we're starting to burn out. And where we're looking, and enforcement is becoming really impossible, and little by little it's becoming more and more violent with people responding. So what I'm going to recommend now is that we move back to our advisory, but with the caveat that we do look at it week by week, and we have the Biobot sewer reports. So when we go back to an advisory, what we're requesting is, and I'm going to open up my screen for a second. When we look at the Biobot sewer report, you see this normalized virus concentration section. And as the major part of it is that it tells us where we are relative to every other place, that every other city and town that is testing their sewer. Even with where we are today, even with a small increase in cases, we're still only in the 13th percentile, which means that for those of you at home, it means that 87% of the rest of the United States is doing worse than us when it comes to COVID. So what we're asking is that when we monitor it week by week, we continue doing our Biobot reports and we keep relating it. When this hits 50%, when we have crossed the median, we put the order back in place, or at the very least a major advisory. But as of right now, I would recommend we move it back to an advisory. Any questions?
Steve, do you mind if I ask a question? It's Melissa.
Go ahead.
Thank you. Roberto, can you remind us when you say mask advisory, what it is you're actually advising? When is it appropriate for people to wear masks and when not to? Or what's the advice on the advisory?
Yes, it's an indoor mask advisory. So it's the same as what we are saying now, except right now we're requiring it. Anytime you are indoors and you are coming in contact with other people outside of your home, you should be wearing a mask. And if you're not vaccinated, you should be wearing a mask. Well, let's also be honest. This has been such a political situation. The people who aren't vaccinating aren't wearing masks as it is already. So it really doesn't matter at that point. So what we are recommending is that people wear masks indoors.
And just a quick follow-up to that, if you're immunocompromised, if you aren't able to get vaccinated for various reasons, so on and so forth, masks for you remain an important tool to keep yourself safe.
Correct. In those of us who subscribe to actual science, we understand that masks do prevent the spread of droplet transmission of the virus.
Mm-hmm.
For those who believe junk science, they think that masks are going to kill you. And if you think a mask is going to kill you, then I really I don't recommend helmets either. So what it really comes down to is, we know that masks work. We know that masks prevent the transmission. They prevent you from giving it to someone else, and they prevent someone else from giving it to you. So what we are saying is, if you're in a situation where you need a mask, whether that is you're indoors, you are immunocompromised, you don't have a vaccine for any reason, you should be wearing a mask when you're in public.
Mm-hmm. Okay.
Roberta,
I had a follow-up, but I can't remember. I'll wait. Go ahead, Jimmy. Sorry.
Roberta, I spent the last week going around to different places. I went to liquor stores. I went to wholesale people. I went to just people in the street and everything, and asked them how they felt about everything. And basically it came out 50-50 for taking the mask. But what about 95% of the people said is they think it's time to, when you go to a restaurant, it seems very foolish to wear your mask up 3 steps to go in a restaurant. Take the mask off, sit down, have dinner with 40 or 50 people. And then if you have to go to the men's room or the ladies' room, which is 5 or 6 or 10 feet away, you have to wear your mask. And then when you're through your meal, you get up, you have to put your mask on to walk out. They said they think that is the silliest thing, and it's time to do away with that.
Okay.
Just pass that on.
Okay.
May I ask? I had another question. I'm sorry. If we vote today to end the mandatory mask requirement and move to an advisory, the masks on boats and planes would still be required because that's a federal requirement. Is that correct?
Those are federal mandates. So masks at the airport, masks in boats, masks inside airplanes, masks in public transportation. Those are all federal mandates. We have nothing to do with that.
Great.
And they are still required. Right.
And
our kids are still wearing masks in school per the state. So we're going to say the adults don't have to do it, but the kids do. And
the kids, if I'm not mistaken, the state mandate stops on November 1st. The school committee voted to maintain masks through January. So that's not a decision of the Board of Health.
no, I just was talking about the state. I didn't know about the school committee.
Yeah.
But I just think our kids until November are wearing masks, but we're going to say that everyone else doesn't have to. And I understand the restaurant discussion, but I just think we're doing really well. And let's say all of a sudden things don't go well, we don't have another meeting for a month. So I just would be cautious. I don't think it's that much to ask to wear a mask to go to the grocery store or.
It's not much to wear. It's not much to ask. It is much to enforce. Its enforcement of it is getting violent. It's getting nasty. It's really not conducive. What I want to what I want to say about this topic, I can't say on camera.
I mean,
If I'm not mistaken, there's an opportunity also if, let's say at the high school, because vaccines are possible for, or in the middle school for ages 12 and up, if you hit a population of 80%, the school can petition the state to remove the mask order. So that again is an available option to the schools. I see what you're saying, but I don't quite agree with the parallel, that kids in school being masked equates with the rest of the community. And I do respect your comments, Roberto, on the enforcement of it. I think Jimmy has always said, it's very difficult to have a policy that we can't enforce. I would support removing the mandate and going to an advisory.
if we go to the advisory, it doesn't, I mean, the advisory is individual business owners, shops. I mean, they can have a thing saying they want you to wear a mask. So
that has always been the case.
yes, yeah, don't not bring a mask or have one in your pocket. You know,
businesses can always require wearing a mask. That's always been the case. Even when we didn't have the mask advisory in place, the Athenaeum was still requiring you to wear a mask when you walked in.
Okay. Does anybody have any more questions or comments?
I think we've gotten to the point where everyone knows what's necessary. Everyone knows what we have to do. The vaccines are there. The treatment is there. We have treatments that work. We have facilities that are able to handle it. We have to start treating it like we do the flu.
And Roberto, just a clarification on Mary's point, you know, if you start to see those case numbers go up or the community in a vulnerable position, hospital getting overwhelmed, then we can schedule an emergency meeting. We don't have to wait 4 weeks or 3 weeks to come to a new meeting. Is that correct?
Of course. Yeah. And even when we were starting to get around 39, 40 cases a day, the hospital wasn't getting overwhelmed because we have ability to treat it now.
Meredith?
Could we have something in it that says, if we reach a certain point, the mask mandate comes back? Is that?
That was the 50%. That was the 50% trigger point that we were just talking about. If we hit that 50%, we can move back up. Jericho actually has a pretty good plan on this. So.
And would that require a vote of the board, or would that just be one of those staff? Would that be part of this vote today that we would enable you to just do that?
Yes, I believe so. Jericho.
Mm-hmm.
So basically the discussion we had earlier this year was around metrics and not having particularly good testing information, so we couldn't have particularly granular metrics with which to trigger particular actions. What we're going to be proposing would be using the Biobot's comparison number with the other areas. So if we pass the median threshold, that would then mean that we are above the average risk for a particular area, and should this board so decide, that would automatically trigger the elevation from advisory to mandate.
Okay. I get a motion to downgrade to.
Can I just say one thing, Steve?
Yeah, go ahead, Jim.
Roberto, can you just lay it out and spell out exactly what we're going to vote on today?
Yes. So what I'm asking you to vote on is to table the emergency order, remove immediate enforcement of the emergency order, with the caveat that if we meet the median threshold of COVID-19 cases, the emergency order comes back into place until we drop below the median threshold again.
And so if we vote on this, what will that mean as far as masks?
So if we vote on it now, so right now we're below 50%. So you don't have to wear masks. And then
Okay.
if we hit that 50% threshold, which we're going to be posting it every week. If we hit that 50% threshold, we will say masks for this week.
Okay, and then we can do that immediately with a meeting right away.
We can do that as staff is what we're asking for.
Can it be masks for 2 weeks, as we know the?
2 weeks. Perfect.
I like that. I'll make a motion to everything Roberto just spelled out.
All right, I'll
second that.
Okay. By roll call vote, Meredith Lepre,
Yes.
Melissa Murphy,
Yes.
Jim Cooper,
Yes,
and Steve Isco says yes. You can hear me.
I just want to say thank you to Roberto, Jericho, the staff and the volunteers who have worked tirelessly. I'm sorry to see the vaccination clinic. I'm happy to see that it's slowing down, but thankful that you all are going to get a little bit of a reprieve. And I just thank you for all your hard work.
The staff has been working tirelessly. Heather, Jericho, and the two Anns, Kathy, John, Artel, Jake now. They've just been working round the clock, and what it really has come down to is I can't push them anymore. I don't want to push them anymore. This is a disease of personal responsibility, and people need to take responsibility for their own actions. And if they want to take a horse pill to treat it, then so be it. But the vaccine will always be your best bet.
so Roberto, when does this go into effect?
Immediately.
Okay, thank you.
And I assume that there'll be good communication out to everyone.
Correct. We'll be reaching out to parents, yeah, as soon as we can.
Okay, fabulous.
Anybody else have any questions or comments for anybody?
Steve, I know that I had had an email, just a comment, and I don't know if it's possible or not, but as a caretaker for a number of properties in Nantucket who do have to update to IA systems, I've had some confusion from homeowners about the timeline that the grace period we voted on to give people to connect if sewer comes to town. And I know that's a capital, bold, italicized, underlined if. But my suggestion or recommendation would be that when Roberto went to look for that, we had to sort of piece it together from minutes. If we could put that together in a simple statement that's easily accessible to the public, I think it would go a long way to provide some clarity.
No, absolutely. After those emails that we were having, I figured that what we can do is make a logic model, if this
Awesome.
that situation, so that we can have.
Beautiful. Great. Thank you very much. I appreciate that. And that's it for me.
Is that something that it would go down in our drop down a list of regulations and information?
Yeah, so right now under the regulations portion, there's a few policy documents in there that say, explanation of room count and definitions and stuff. We'll put it in that. We'll have to start parsing it out on some guidance documents.
Okay, thanks.
I mentioned that because there is, renewed conversation about bringing sewer to Nantucket. So I think a lot of people are thinking they can hedge their bets, but that's not a good bet to take. So we just want to be clear about it. If there's nothing else, I'm happy to make a motion to adjourn.
I'm happy to second that.
All in favor by roll call vote, Meredith Lepre,
Yes.
Jim Cooper,
Yes.
Melissa Murphy,
Aye, thank you.
and Steve Visco says hi. Thank you, everybody.
Thank you.
Thank you.